Mr. Leong Mun Wai.
Madam Deputy Speaker, the Progress Singapore Party, PSP, supports the motion, which calls on the House to support healthcare beyond the COVID-19 pandemic and the whole of government effort in consistent and sustainable support of Singapore's healthcare system. The PSP once again thanks all healthcare workers for their sacrifices and dedication to serving Singaporeans, especially during the past 3 years of the pandemic. We welcome the government's move to support healthcare through the Healthier SG initiative, which shifts away from a transactional system that reactively cares for those who are already sick towards an outcome-based system aimed at preventing Singaporeans from falling ill. Honourable members Dr. Tanya Swam, Dr. Shahira Abdullah, Mr. Abdul Samad have spoken passionately about grounds-up improvement involving the doctors, healthcare workers, patients, and society at large. We support those improvements that they have mentioned. But we also think that they can be better realized by first looking at how to reform healthcare financing and bringing healthcare costs under control. PSP defines sustainability in healthcare as providing the most effective healthcare to all Singaporeans that is affordable and equitable. The focus should not be on protecting the government's coffer alone, but how to put in place a healthcare system that has the proper incentives to encourage healthy living and at the same time covers all Singaporeans for all medical circumstances throughout their lives. Currently, Singaporeans shoulder much of the cost of healthcare through their Medisave savings, their children's Medisave savings, payments from Medishield Life, private insurance, and cash outlay. I acknowledge that over the past decade, the government has spent more on healthcare, with the introduction of schemes like the Pioneer and Merdeka generation packages, as well as the CHARS. But the actual spending of these packages is small relative to the needs of some Singaporeans of the Pioneer and Merdeka generations, who do not have much Medisave savings. The actual spending is also small relative to the total assets of the Pioneer Generation Fund and the Merdeka Generation Fund. Overall, the government has not contributed enough to cover healthcare expenditure. According to the World Health Organization, the share of healthcare expenditure covered by our government has increased from 33% in 2011 to 43% in 2019. But this is still much lower than the OECD average of 75%. Singaporeans are experiencing first-world healthcare costs, but receiving much less first-world financial support from the government. Healthcare spending has more than doubled over the past 2 decades. It is not sustainable for Singaporeans to continue footing much of their healthcare bills, as well as those of their parents and children. To reduce social inequality, the government must do more to help Singaporeans cope with rising healthcare costs and strengthen their financial security. People do not choose to fall ill, whether they are rich or poor. But while a wealthier family can handle a medical catastrophe better, a similar catastrophe can easily wipe out the Medisave and cash savings of a low-income family, even after Medishield payouts. As a result, Madam, I would like to make 3 recommendations to reduce the financial burden of healthcare for Singaporeans. 1. The government should pay for Medishield and CareShield life premiums for all Singapore citizens. Retirement adequacy for Singaporeans is a perennial issue. First, housing cost depletes most of their CPF savings, so many Singaporeans must continue to work beyond their retirement age to survive without selling their HDB flats. Insurance premiums take up another chunk of their CPF savings, which could have been used for retirement. In my Budget 2021 speech, I estimated that the total Medishield and CareShield premiums paid by a family of 4 up to 65 years old of age for the parents and 25 years of age for the 2 children will drain at least $110,000 from the parents' CPF savings, not including the loss in compound interest over the years, and that is at current premium levels. If the premium increases by 10% every 5 years, which is highly possible, the financial drain could be more than $250,000. In other words, if the family did not need to pay Medishield and CareShield premiums, the parents would have more than $250,000 extra CPF savings for retirement at age 65. So I repeat my call from the 2021 budget debate and urge the government to fund Medishield Life and CareShield Life premiums for all Singapore citizens. This will increase government's expenditure by about $3 billion a year. But this also means the CPF balances of Singaporeans will increase correspondingly by that amount. This will allow the average Singaporeans to have their Medisave balances enjoy the compounding effect of the CPF interest for a longer period and be better prepared for a medical event. Healthier Medisave balances would ultimately strengthen the retirement adequacy of Singaporeans because less CPF savings will need to be transferred to their Medisave accounts. My second recommendation is for the government to top up and expand the use of Medisave, increase Medifund support for needy Singaporeans, and increase Pioneer and Merdeka Generation Fund support for the older Singaporeans. As of 2020, Medisave account holders have accumulated $110 billion in balances. However, only $1 billion, or less than 1%, was withdrawn for direct medical expenses that year. This is a tiny percentage and has decreased from 2015, when $905 million, or 1.2%, was withdrawn from a $76 billion balance. This does not make sense, given Singapore's aging population and increasing demand for healthcare. Are the rules of withdrawal from the Medisave accounts too restrictive? The government has always restricted withdrawals from Medisave accounts, but on aggregate, Singaporeans are not even fully utilizing the interest they earn each year on their Medisave balances for medical expenses, let alone their principal sums. The withholding of Medisave monies for use by its owner is even more unjustifiable than the requirement to maintain minimum sum balance for the retirement account. I therefore repeat my call for the Medisave withdrawal limit to be relaxed. I also echo my colleague Hazel Pua's suggestion at Budget 2021 for the expansion of Medisave eligibility for outpatient treatments. For low-income Singaporeans who have below-average Medisave balances and therefore have trouble paying medical expenses, the government should provide more help by either topping up their Medisave accounts or increasing assistance from the Medifund substantially. Currently, the Medifund only dishes out about $100 million a year, which only covers a paltry 0.4% of Singaporeans' total healthcare expenditure of about $25 billion a year. The Pioneer and Merdeka Generation Funds should also increase its payout to help older Singaporeans. Since 2018, the Pioneer Generation Fund has a balance of about $7 billion, but it only pays out about $400 million, or about 5 to 7% of its total assets each year. The Merdeka Generation Fund has a balance of about $6 billion, but it only pays out about $200 million, or about 3 to 5% of its total assets each year. My third recommendation is for the government to centralize drug procurement across public and private medical institutions. Currently, drug procurement is centralized for Singapore's 3 public healthcare clusters, but not for private medical institutions. Consequently, private clinics generally pay more for drugs than the public sector, which can negotiate good prices. This drives up costs across the healthcare chain. Insurance must charge higher premiums to cover higher drug prices. This will cause the national healthcare expenditure to rise unsustainably. The PSP calls on the government to centralize drug procurement across all public and private medical institutions and distribute drugs to public and private health facilities on a not-for-profit basis. This will reduce our overall cost of drugs by gaining power as a small nation with the big pharma companies. In the public sector, the government should ensure that the price of drugs charged to all Singaporean patients, subsidized or non-subsidized, is at or near the cost price of drugs. The government can provide additional subsidies to lower drug costs for subsidized patients, but drug prices should not be marked up unreasonably for non-subsidized patients to cross-subsidize the subsidized patients. It is reasonable to charge non-subsidized patients higher prices for better services they receive, but not the drugs they take, because they are the same. A centralized drug procurement system at the national level would do away with the need for sudden policy changes to control healthcare costs, provide certainty to Singaporeans, and strengthen their retirement adequacy. In conclusion, Madam Deputy Speaker, I call on the government to make a greater effort to address the inequalities in Singapore's healthcare system. This can amplify the benefits brought about by initiatives such as Healthier SG. For many Singaporeans, financial pressures from the high cost of living are a major cause of their poor health. including the growing problem of mental illnesses. If more is done to improve the affordability and equity of Singapore's healthcare system, we can expect an improvement in the general health of Singaporeans as well. This should be one of the national priorities as we support healthcare beyond the COVID-19 pandemic. Singaporeans deserve better for country, for people.
Leader.
Madam Deputy Speaker, I beg to move that the debate be now adjourned.
The question is that the debate be now adjourned. As many as are of the opinion, say aye. To the contrary, say no. I think the ayes have it. The ayes have it. Resumption of debate. What day?
Tomorrow, Madam.
So be it. Leader.
Madam Deputy Speaker, I beg to move that Parliament do now adjourn.
The question is that Parliament do now adjourn.